Hi, and now we're going to look at Chapter 6, Part 2 in Lifestyle Management around managing our weight. So in Part 2, in managing our weight, we're going to consider some of the practical weight management tips. And in these difficult times, some risks, some people risk, some of us face some difficulties with our relationship with food. Life can get busy, complicated, and very challenging, and in spite of all this, we need to eat and we need to move to be healthy. So now let's look at some of these, and we'll begin now. Okay, we're going to begin with a practical guide to weight management. Now there's a few things I'm going to reference here. And of course, if this is all in your textbook, you should be fine. No diet can produce permanent weight loss or weight gain. Successful weight management requires a lifelong commitment to healthy lifestyle behaviors, emphasizing sustainable and enjoyable eating practices and daily physical activity. Another key to long-term success is tailoring any weight management program to the individual sex, lifestyle, cultural, racial, and ethnic values. It really increases the likelihood when we align ourselves with the things that we value and find as important. So overcoming some serious weight problems. Each year, an estimated 70% of women and 35% of men are dieting at any given time, but no matter how much weight they lose, 95% gain it back within 5 years. That tells us an awful lot about dieting and its success rate as opposed to healthy eating within our lifestyle and healthy physical activity within our lifestyle. Most dieters cut back on food not because they want to feel better, but because they want to look better. And there's the juxtaposition. Looking better isn't necessarily being better. So eating in a more healthy and acting in a more healthy manner is going to have bigger impact. The best approach to weight problem depends on how overweight a person is. For extreme obesity, medical treatments including gastric surgeries may be necessary to overcome the dangers of a person's health and life in the short term. For people who are moderately to mildly obese, doctors recommend a 6-month trial on lifestyle therapy, including a supervised diet or exercise. So what's being recommended here when you talk about moderate to mildly obese or heavy or overweight people is don't do it for a short period of time, look for a quick fix, but 6 months of lifestyle therapy. Now you don't have to necessarily, although it's recommended that you see a doctor certainly if you have overweight, but looking at lifestyle therapy is just really examining one's life and how you can introduce health into your lifestyle over time. Now the key to overcoming obesity are addressing individual differences, altering unrealistic expectations, setting limits, learning coping skills to provide self-nurturing without relying on food. Now, rather than going on a low-calorie diet, people with BMIs of 25 to 29 should cut back moderately on their food intake and concentrate on developing healthy eating and exercise habits. And then again, time. Allow things to take place, allow things to be engaged in everyday lifestyle planning. Customizing a weight loss plan, well, the key to weight loss is recognizing ways that you tend to put on weight and to developing the strategies to overcome them. And so when those of you who might be doing assignment A and using as a weight loss as part of your planning is keep in mind, why do you eat the way that you do, or why don't you exercise the way that you'd like? What are the things that are holding you back that you can work on to get to where you can actually eat in a more healthy way and approach food healthfully and be able to engage in some lifestyle activities that keep you healthy? Looking at what or how much you eat and when, why, how you eat are important steps in developing healthy eating habits. So it's not just about what you eat, it's examining why you eat, when you eat, what are you eating about, under what circumstances. Keep a food diary to keep track of calories, fat grams that you eat and when. You can also track your daily food and activity choices and compare them to guidelines set out by the Health Canada and the Dietitians of Canada. They have what's known as an EA tracker tool, or there's an app for that. There's an app for anything. So if you're looking for stuff around diet or exercise and doing your assignment A, there is an app for that. Find one, and that will give you the digital material you need to keep track of things to attach it to your assignment. Consider, under what circumstances are you eating? Is it time to eat? Are you bored? Are you upset? Deal with these issues. Dieting may not be the only or even the best solution for you. Consider, are you a grazer? Do you nibble and snack on high saturated fatty foods? Instead, graze on carrots, celery, drink water, and sit at the kitchen table. I remember when I quit smoking back in 1981, October 26. One of my strategies was I didn't want to gain weight while quitting smoking, as I had heard that that was a very common effect. So I walked around with a briefcase carrying carrot sticks and celery sticks. Not only did I quit smoking, but I lost 15 pounds. So sometimes it's what you graze on, not whether or not you graze. Any physical activity, walking, jogging, something aerobic, will be helpful on this, on this plan, on this trip to losing weight and getting healthier. So, how do I avoid the diet traps? Well, let's first identify some of them. Diet foods. There's a diet trap. Foods labeled as light may be high in sugar and calories. It's important to not just read the label, but to understand the label of the foods that you're purchasing. For example, Olestra is a fat substitute. It tastes like fat, but its molecules are so large they can't be digested, so they pass through our digestive tract without leaving any calories behind. Now, Health Canada has rejected Olestra as a food additive based on its own research. And in fact, in the United States, the Food and Drug Administration, the FDA, has received more than 18,000 adverse reaction reports of gastrointestinal distress. Now, that's only one example. So it's important to understand labels and read them and understand where your calories are coming from. Food made with fat substitutes may have fewer grams of fat, but they don't necessarily have significant fewer calories. And so this road to healthier eating takes a little bit of education and learning about how to read labels so we understand what we're eating and if it's in fact good for us. Another thing to be wary of, and many of you may already know about this, I certainly have in my own lifetime, it's the yo-yo syndrome. This is the on-again, off-again dieting can be self-defeating and dangerous. Now, weight cycling, as it's also known, may make it more difficult to lose weight and keep it off. So if you tend to lose weight, gain weight, lose weight, gain weight, lose and gain, it becomes a pattern that often is hard to break. You can avoid the yo-yo syndrome and overcome its negative effects by exercising. Simple. Now, exercises don't need to be as complex as you might think. Sometimes exercising is going for a walk, putting in 10,000, 15,000, 20,000 steps per day. That's good exercise. And that exercise helps alleviate the dieting that goes like this, because a lot of the dieting that goes up and down, yo-yoing, doesn't involve much exercise. It's strictly diet. There's no magic pill. Weight loss is about healthy eating and exercise. That's the magic pill. Another area to avoid or be wary of, very low calorie diets. Diets that provide fewer than 800 calories a day can be risking, and I would almost be saying, no kidding, 800 calories a day, you can't exist on that. On a very low calorie diet, as much as 50% of the weight you lose might be muscle, not fat. And muscle weight helps engage you with the physical activities you do every day. The ill effects of low-calorie diets include low blood pressure, dizziness, lightheadedness, fatigue, nausea, abdominal pain, hair loss, irregular menstrual cycles in women, slowing of metabolic rates, and slowed reaction times. These metabolic changes may make it harder for people to maintain reduced body weight after dieting. Be very wary. And of course, something that we're probably all aware of, fad diets. There's no scientific evidence proving that diet provides more than a 10 to 15% of protein recommended by the federal guidelines that health and athletic performances even have any effect. Scientific advisory warnings that high protein diets are potentially dangerous because they increase the risk of heart disease, diabetes, stroke, kidney and liver disease, and cancer have just been made more recently. It's important to recognize that, any healthy diet doesn't mean increasing one of the three main, protein, calories, and fats up and lowering everything else. It means maintaining the levels which are healthy and maintaining them over each meal. And so when we see these fad diets that say high carbohydrate, low protein, or high protein, low fat, we got to question, because there's not any scientific support for these claims. These are just ways for people to market ideas that can sell books and make other people rich. Now, while dieters just eat as much or even more food on some low carbohydrate, low fat diets, they are ingesting fewer calories and much less fat. However, this practice can be so unsatisfying that many people cannot stay on the diets for sustained periods. They end up dropping off the diet and then binge eating, creating what we'll look at later are some other unhealthy behaviors when it comes to eating. Now, another point worth drawing our attention to is over-the-counter diet pills. Now, in their search for quick fixes to weight problems, millions of people have tried and often risky remedies. You may have heard of some professional athletes dying from having used some of these over-the-counter diet pills, that what it did, it increased heart rate so much that they died of heart attacks while during practices. The search for the perfect diet drug continues with plenty of economic incentives for drug makers to do so. People don't want to do the work to eat healthy and exercise. They want a magic pill. One just doesn't exist. And I'll say yet, because I'm sure something will happen that will create something. But the basis of healthy, eat right, getting some physical activity. So some physical activity, a helpful approach. The combination of exercise and cutting back on calories may be the most effective way of taking weight off and keeping it off. Exercise increases energy expenditure, builds muscle tissue, burns off fat stores, and stimulates the immune system. It may be that it also reprograms the metabolism so that individuals burn up more calories during and after a workout. Some everyday activities such as walking, gardening, heavy household chores are as effective as structured exercise program in maintaining or losing weight. But anything that increases your heart rate for a sustained period of time is going to benefit your body and help increase your metabolism. People who start an exercise program during or after a weight loss program are consistently more successful in keeping most of the weight off that they lose. A real plus in regards to physical exercise coupled with healthy eating. So, what if you want to gain weight? How do you do it? I know that might be a peculiar question because most people aren't seeing that as a problem. But being underweight is not an uncommon problem, particularly among adolescents and young adult men, as well as those who diet excessively and suffer from an eating disorder. Following these suggestions for weight gain, for example, eat more of a variety of foods. If your appetite is small, attempt to eat more frequently. Drink juice or milk. In a study done in Britain looking at thirst quenching, effective thirst quenching, milk was actually one that came out higher than water and juice, partly because milk is made up of more than just water, and it's those other ingredients in milk, calcium, the carbohydrates and protein, that the body uses, and while it's doing that, it stores some of the water a little longer. Manage your stress level, that's a key one, and exercise regularly. The psychosocial views on weight management. Now, psychosocial is psychology based on what's in me that makes me think, and sociology is about how does the group and other people affect me. So when we think about these psychosocial views on weight management, one that pops up is weight discrimination. To address obesity issues in society, we must be cognizant of the need for sensitive and caring approaches to people struggling with weight. The stigma and discrimination towards people who are obese are pervasive and impact both psychologically and physical health. You're probably very aware of body shaming issues that occur online and people targeting others who think that there's some authority on what's right and wrong for other people, need to express somehow that that's not okay, and they body shame. We seem to think that we understand it's not okay to tell jokes about certain groups of people, but it appears as if it's still acceptable in some parts of society to joke and poke fun at people who are struggling with weight. Society condones weight stigmatization as a way of motivating obese people to lose weight. When has that ever been the case? And yet, we still in society seem to think that's the way to do it. Discrimination, however, is not beneficial in reducing obesity rates, as it generates health disparities and interferes with effective obesity intervention. A lot of people who have weight issues are also dealing with other emotional issues. To body shame and to discriminate just elevates those other issues as well. Another point to bring is economics and obesity. Economic frameworks are helping to explain some of the psychological effects of obesity. Now, one of the main areas when we talk about economics is income. An income effect is present when food is one of the things of value we want to and need to purchase within our limited budget, say, and so food increases, which is a result of higher caloric intakes. Some of the foods that we choose to pick because of our lower income and because of less money is food that's not always good for us because it's cheaper. Options for food purchases have increased from over-the-counter coffee stores to bakeries and tasty and fast food restaurants because they're easy to see, they're easy to get to, they're relatively inexpensive. We tend to fall into those traps. The substitution effect suggests that an emerging economic recovery and further technological advances will lead to an inevitable rise in obesity levels continually in North America. Provincial and national initiatives. The provincial and national governments are addressing or attempting to address nutrition, overweight, and obesity issues by developing and designing nutritional initiatives and programs. Strategies for the future include improving serving size, what's considered a normal serving size, nutritional labeling, banning certain foods and ingredients, regulating sodium consumption, limiting access to junk foods in schools and community centers, designing walkable communities, building partnerships between nutrition, physical activity, health economics, medical school, and community leaders. Now, one place that might affect you because you are a student and on a campus is campus eating. Eating habits often change immensely when college or university students begin their studies. The most common weight-related problem is gaining weight, particularly in the first year. A study revealed that eating behavior was related to lifestyle factors, hours spent on campus, commute time to campus, weekly budget for food. When food is brought to campus, less fast food is purchased and consumed on campus. You probably have an opinion about what food is available for you on campus. Part of that might be around healthy choices. Some of that might be kind of related to cost. But at any rate, you can see how that could affect your weight in your first year when you have freedom to choose and no one telling you can't do it. To address the unique nutritional needs of students, administrators, faculty, student services, recreational departments, and students themselves are making inroads to improve nutritional alternatives on campus. Some of the nutrition that's experienced on our campus has improved as a result of students making overtures to see those improvements. If you're a student who is noticing a small weight gain and have made plans to lose some weight but have not been successful in the past, check out nutrition and exercise options available to you on your campus. We have a gym downstairs, and on the other campuses there are gyms on the main campuses. Check it out. So unhealthy eating behavior. Now this section here will be looking at the unhealthy eating behavior that can take many different forms, ranging from not eating enough to eating too much too quickly. And the roots of these eating disorders are complex. So let's look at some of these. Now, body image is one that you don't sort of treat as a disorder per se, but many young women are attempting to become slimmer while young men are attempting to become more muscular. And part of this is based on the images that we see of what is considered to be desirable. And so it becomes somewhat more of a disorder when that's our focus and not about looking inside ourselves and saying, what's important to me? How do I eat healthfully and exercise healthfully to create a lifestyle, as opposed to a fix to meet an image that someone else seems to think I should be? In a study, girls who watched a lot of television and expressed concerns with slimness and popularity were more dissatisfied with their bodies than girls involved in sports. So it has a lot to do with what we see out there in the world being depicted about what am I supposed to look like and how am I supposed to behave like. Men and women are prone to different distortions of body images. Some of these are ones that you'd be familiar with. When we talk about eating disorders involve a serious disturbance in eating behavior. In addition to either eating too much or too little, individuals who suffer from eating disorders have great concerns over body size and body shape. Now, individuals with eating disorders display a broad range of symptoms that occur along a continuum. So it means if you have an issue, it's on a continuum. There's some people who are over here, some in the middle, and some over here. Eating disorders include anorexia nervosa, bulimia nervosa, binge eating disorder. We can also look at some others, and we will. So who develops an eating disorder? Well, most people with eating disorders are young, between the ages of 14 and 25. They're usually white, usually female, and usually of an affluent background with perfectionist personalities. They need to be the best, or they need to be perfect, not necessarily the best. Eating disorders are increasing among men and members of different ethnic groups. Male and female athletes are also vulnerable to eating disorders because of the pressures to maintain an ideal body weight and to achieve a weight that might enhance their performance. And we're seeing this a lot in combat sports, boxing, wrestling, MMA, where an athlete might be competing at a particular weight, maybe 135, 155 in a weight category, but they walk around at 170. And so in order to get into their weight category, they have to drop a lot of weight relatively quickly to meet that weight at the weigh-in, and then 2 days later they're in the fight ring and they're back up to that weight. What does that do to a person's performance? And they find it's not working so well. Sometimes it does for some people. So let's begin. Anorexia nervosa. Now for those who suffer from this disorder, food is seen as an enemy or a threat to their sense of self, identity, or autonomy. So what often will happen is they see themselves as fat or flabby, even at a normal or below normal body weight. My sister had experienced in her young teen years anorexia. She's 5'11". Normally she walks around at around about 130, 140 pounds, but she was down to 90 pounds. When she would look in the mirror, she'd still see a fat person. And of course, she wasn't. But that's not what she saw. And people who experience anorexia nervosa, oftentimes, their perception of their sense of self, their identity is not what you and I see. The incidence of anorexia nervosa has increased in the past 3 decades, and mostly in developed countries, affluent countries like North America. An estimated 0.5 to 4% of young women in Canada develop anorexia. And you put, say, even 2% and put that in the population of young women in Canada, that's a very large number. In the restricting type of anorexia, individuals lose weight by avoiding any fatty foods and by dieting and fasting. They might also start exercising or smoking to control their weight. So much so that they'll eat very small amounts of food. You may not see them very frequently eating. Some anorexics who eat something they feel they should not have eaten may purge, similar to bulimics, but not to the same rate or degree, because anorexia, they just don't put very much in. Bulimia, they do. Now, another form that's related to athletics more, and also a little bit more related to men, is what's known as anorexia athletica and muscle dysphoria. The anorexia athletica is not clinically defined as an eating disorder. This condition is similar to anorexia nervosa in that individuals deal with body image issues by overcompensating in the form of, in this case, over-exercising. They'll spend hours doing, spin classes, doing weightlifting, skipping. They'll do a number of exercises, all in an effort to burn calories and build muscle. Their behavior gives people a sense of control and power over their bodies. People who suffer from this condition are often meticulous about their eating habits and may restrict calories too. Now, some men, they suffer from muscle dysphoria. This is where they engage in excessive strength training sessions because they have an obsessive desire to appear more muscular than lean. They may also take steroids or muscle building drugs. And you'll find that some of the men who compete in shows to show off muscle mass are maybe some who are experiencing muscle dysphoria, an obsessive capacity to get larger, bigger, leaner, such that they can see the striations of muscles that are existing rather than these soft muscles. Now, bulimia nervosa. Here, individuals with bulimia nervosa go on repeated eating binges and rapidly consume large amounts of food. Now, they don't stay there. Those with purging bulimia induce vomiting or take large doses of laxatives to relieve guilt and control their weight. Now, you can imagine what this can do to one's body, this eating and purging, eating and purging. In non-purging bulimia, individuals use other means such as fasting or excessive exercises to compensate for the binges. There's an estimated 1 to 3% of women have developed bulimia. The average age of the onset is around about 18. Now, you might say, well, why is it that women seem to be more prone to anorexic nervosa and bulimia? Well, in our society, there's more pressure on women to achieve a certain image. So the image and self-identity of that image about what am I supposed to look like gets altered more frequently than it does with men. We see it starting to emerge with men because that misconception about body image is starting to adjust and change for men, and men are starting to stress and be affected by that as well in their own life. Now, another form of eating disorder is what's called binge eating disorder, BED. Binge eating disorder, this is the rapid consumption of an abnormally large amount of food in relatively a short period of time. It often occurs in compulsive eaters. Now, this isn't just, a bag of chips and a liter of Coke. This is excessive overeating in a really short period. I mean, It's compulsive. It's not the same as something that you and I might do on a weekend sometime when we happen to have a bag of chips and a couple of things of Coke. No, this is something much more significant than that. Individuals who binge eat may feel a lack of control over eating and binge at least twice a week for at least 6-month period. That's when it becomes clinical. So to give you an idea, that you and I, we might binge once or twice in a 6-month period. That's not the kind of concern that someone in this category, binge eating disorder, will be in. Twice a week for 6 months. Then we've got a serious, serious problem. Treatment includes education, learning about why you do what you do, and behavioral approaches, how to correct some of those things, cognitive approaches, which is changing thinking, and psychotherapy as being another. Now, another form of challenge is what's known as extreme dieting. Extreme dieters go beyond cutting back on calories or increasing physical activity. They become preoccupied with what they eat and what they weigh. They're constantly checking their eating. They're buying only the food that's good for them for low-fat intake, and they're busy mapping out their physical preoccupation and activities. Although their weight never falls below 85% of normal, their weight loss is severe enough to cause uncomfortable physical consequences, and they're at an increased risk for anorexia nervosa. Dieting and exercise become ways of coping with stress in life. Many avid dieters may need counseling to correct the dangers of eating behavior and preventing further complications. It's interesting how much there is to deal with when it comes to something as simple, if you will, as eating. Compulsive overeating. People who eat compulsively cannot stop putting food in their mouths. They eat fast and they eat a lot. Now, compulsive eating is different in terms of there's a few psychological disorders that involve compulsive eating. Prader-Willi is an example, and that's a condition by which a person constantly seeks out food. If it's not locked and they're not kept from it, they will eat and eat and eat. They don't have an off switch. Now, this is not that. Some mental health professionals describe compulsive eating as a food addiction that's much more likely to develop in women than in men. Now, the following behaviors may signal a potential problem with compulsive overeating. And we'll look at a few here as a reminder. 1, turning to food when depressed or lonely, when feeling rejected, or as a reward if food is used for a number of reasons and it's used excessively. A history of failed diets and anxiety when dieting. Thinking about food throughout the day. Not just having, I really have a desire for something. No, thinking about food all the time, every day. Eating quickly and without pleasure. You may not even know what you've eaten that quickly. Continuing to eat when we're no longer hungry. Frequent talking about food or refusing to talk about food. The fear of not being able to stop eating once started. These are some of the conditions that people with an overeating issue deal with on a regular basis. Recovery from compulsive eating can be challenging because these people with this problem cannot give up entirely the substance that they abuse. And therein lies the dilemma for most of the food eating disorders, is that it involves something that we need every day. And their disorders are wrapped around something along those lines, and it makes it more difficult. Okay, I hope this has been helpful. There we go. Don't forget, we have a test coming up, so check your syllabus for the open and close dates and the times. Good luck, everybody. Bye now.